Reed, go.
Hi, I'm Reed.
Good evening. My name is Sam Crouter, and tonight I will be giving you a speech about the dangers of concussions. As those of you who are present know, I was in a car accident almost 4 years ago on my way to work. This was not my first concussion, but it began my long road of dealing with persistent post-concussive syndrome. A concussion is a traumatic brain injury. It is caused by any blow to your body that is strong enough to rock your brain in your head and cause bruising and swelling. According to the CDC, almost 2 million people in the USA are diagnosed with concussion every year, and the University of Pittsburgh estimates that half of all concussions will go undiagnosed. Concussions are commonly associated with sports, but they also can come from many other activities. Only 10% of concussions each year are sports related. The symptoms of concussions can vary widely from case to case. In the immediate aftermath of the concussion, you can suffer from dizziness, headaches, loss of consciousness, ringing in the ears, nausea and vomiting, fatigue, blurry vision, light and noise sensitivity. You can have mood changes and increased irritability, as well as suffering from a delayed response to questions. The most important part of treatment is minimizing the risk for a second impact. A second concussion in the short term after your immediate concussion can have exponentially worse effects as it increases the swelling while your brain is still trying to heal. Symptom management is important to helping the patient recover and can include physical therapy, medication, and bed rest. It has long been thought that a person who received a concussion should stay on bed rest for at least a few months until all of their symptoms have gone away. This method of thinking has recently been challenged by a study led by Dr. John Letty from the University of Buffalo that found that light exercise up until the point before you would start experiencing symptoms from your concussion can hasten your recovery process and remove some of the lasting effects. According to Dr. Murray Stein from the University of California in San Diego, there is an increased risk for PTSD and major depressive episodes in individuals who suffer concussions that are less educated, received their concussion from violent means, have a history of mental illness, or if the individual is African American. Long-term issues with concussions can be attention deficit issues, memory problems, irritability and personality changes, sensory sensitivity, trouble sleeping, depression, anxiety, PTSD, loss of smell and or taste, and can also have many different effects based off of what areas of the brain are harmed. In conclusion, I hope that you've learned more about concussions than you started out knowing, and I hope you have a great night.
All right. Readers?
Hey, I'm Reed.